Ever since I was a kid, I always liked dentistry. I liked going to the dentist. I thought it was a really cool job. I always liked playing with, all the stuff in the room, against the advice of my parents. But it's something I always enjoyed. And what got me into implant dentistry was I've always been intrigued by learning and by things that challenge me. And implant dentistry gave me just that, exactly what I was craving. What I do is we do a lot of full mouth reconstructions, and that really does change a person's life. They go from being very reserved and sometimes even depressed to just being outgoing and smiling everywhere. And it really is life-changing. And for people to gain that confidence back, it really does, it really means a lot to me. My vision for my dental practice when I opened it was to have a state-of-the-art facility that provides an awesome patient experience. From the moment you walk in to the moment that you leave, I just wanted it to be very relaxing and comfortable for the patient. I knew I always wanted to bring in lots of technology, and not just for the sense of having it, but actually making the experience for the patient better. And because we have everything under one roof, we can make sure that the patient has the best experience possible. And it's pretty much one-stop shopping for them, so they don't have to travel different places to get the service they need. One of the things we do have that we take a lot of pride in is our new Yomi robot, which will deliver a much better patient experience in terms of faster healing and more accurate placement. Here at West LA Implants, you're going to be treated with respect no matter what your background is, and we personalize each experience to the individual rather than just having one treatment plan for everybody. They're going to come in and be treated like a family member every single time, and they're not going to leave until they get the smile they want. What I look forward to most every day is coming to work and having the opportunity to make people feel good about themselves. If I had to choose my career over again, I don't think I would change anything. I've been very blessed and happy to be doing what I'm doing. I'm very lucky that I get to make people feel good about themselves, give them back a part of their lives that they've been missing, oftentimes for years, and see them really transform. That for me is what it's all about. Experience there's so many little details and nuances in implant dentistry. I mean, we're working in a world of millimeters here, so even the smallest little detail makes a big difference. I think it's a great thing for patient to ask questions. I mean, there's a big difference between a dentist taking a weekend course and one who's actually taken the time to learn this trade properly, to place implants and make sure they're in the right position and they have the correct tools that they need to do the job right. They should definitely ask how long they've been doing it, how many they've placed, where they were trained. I think those are all great questions for a patient to ask a dentist. When somebody calls over the phone asking for a price for implants, we tell them it's best to come in because there's no one way to treat everybody. It's pretty much every case is different, every patient is different. There's a lot of places that do $3.99 implants, $2.99 implants. It's not necessarily about price, it's about quality. What a patient can expect getting implants here is a one-stop shop for everything. From the planning phase to the restorative phase, we can handle it all. The patient will come in for their initial consultation. We'll let them know what their exact needs are. The day of surgery, they'll come in. They'll either get the tooth extracted and an implant placed, or if the tooth is already missing, we'll place the implant. They'll heal for about 3 months or so, and then we'll take impressions for a final crown or a final prosthetic, and then they'll be good to go. Another thing patients should be aware of is overselling or bait and switch tactics. Here at West LA Implants, we're going to give you plenty of options in a no-hassle, pressure-free environment. We're going to tell you exactly what you need, and we're going to decide together what's best for you. If you guys have any further questions regarding implant treatment or dental treatment as a whole, I invite you to come check us out and try the West LA Implants difference. I think you guys are going to be really happy. When it comes to cosmetic dental procedures, everybody has different goals and expectations that they want to achieve. From the color of the tooth to the size and shape. Transformative dentistry is pretty much a full mouth rehabilitation where we take somebody from point A and give them the dream smile that they want, that Hollywood smile. Whether it be veneers, crowns, implants, I'm going to give you the top 3 cosmetic dental procedures that people tell me they really want. One of the top transformative dental cosmetic procedures there is veneers. A veneer is basically a new face for a tooth. It's only changing the front surface, the part that's visible, and it's really the most conservative thing we can do for a tooth because we don't have to grind down the tooth to, a little stump in order to fix it. People who are a candidate for dental veneers are people with solid tooth structure. They don't have a lot of decay. They're just looking for a brighter, wider smile, a more cosmetic result that allows them to keep their teeth, but just pretty it up a little bit. Number 2, whitening. Sometimes people are happy with the shape of their teeth, they just don't like the color. With our laser whitening system, we can get you in and out in about 30 minutes, and you're gonna have that bright white smile you want. And number 3 is dental implants. Dental implants play a huge role in not only cosmetic, but also functionality. From single units to a full mouth, dental implants are the closest thing you can get to teeth. Candidates for dental implants are usually people who are missing teeth or have terminal dentition, lots of decay, teeth that are not salvageable, teeth that need to be removed, and somebody who doesn't want to go the bridge route and who wants to have a more natural solution, a more functional solution than a traditional bridge. The procedures that you can get here at West LA Implants in a day are whitening and, believe it or not, veneers. You can come in for your veneer appointment and we can prepare your teeth, take the impressions, send that to the lab, and while that's being made, we can have you home in a nice bright white set of temporary veneers. Dental implants can also be delivered in a day. Depending on the right candidate, you can leave start to finish with a tooth in your mouth the same day, and certainly if you're doing the full arch, you will also leave here with teeth in a day. If you're not happy with your smile and you feel like you want to improve it, give us a call. We can schedule a complimentary consultation for you and give you that bright white smile you've been looking for. Technology plays a huge role in our daily lives, especially nowadays. From our smartphones to our smart homes, smart TVs, everything seems to be automated and technology driven these days. Medicine has been using technology for years. I've had debates with my dental colleagues, especially older ones who are very iffy on newer technologies such as the Yomi robot, but in all honesty, I think it can reduce human error almost down to zero. I still control the robot, but it can put me in that same hole time after time, blindfolded if I wanted to. Yomi is a robotic assisted implant robot, and what it does is it orients my hand into position in the correct 3D axis where I can place the implant on a computer and the drill knows exactly where it is in space relative to the patient, and it just drills the hole perfect every single time. Freehand versus guided surgery versus robotic guided surgery is completely different. With freehand, it's all based on me. If I'm off, the implant's gonna be off, the angle can be off. There's a lot of variables to go wrong. With the Yomi robot, I don't even have to lay a flap or raise the gums to know that the implant is in the perfect spot every single time. If it's where I planned it on the computer, it's gonna be like that in the mouth. Now, that's not to say you can't do it freehand. There are plenty of people out there, myself included, who can do it freehand, who have been doing it freehand for years, but the Yomi robot allows us to place it with more comfort for the patient and in far less time. Anybody who's a candidate for a dental implant is a candidate for a Yomi guided implant. And in fact, I'm always gonna recommend it because it's gonna be faster for you. It's gonna help you heal faster since I don't have to, make large cuts in your mouth. And it's just gonna be an overall more pleasant experience. If you're interested in our Yomi robot or getting dental implants, I invite you to come check us out for a free consultation and a CT scan, and we'll even give you a tour of the robot itself. A lot of people don't know why they need to get their wisdom teeth removed, or they've seen people, they've heard people who have been in a tremendous amount of pain, swelling, bruising, but there's actually a really important reason why you need to get your wisdom teeth removed. Wisdom teeth, third molars, really serve no function other than to cause us problems at this point in life. Back in the day, they actually served a purpose when people weren't keeping their teeth as long, but today they're more of a nuisance than anything, and they're really not needed for normal everyday life. Problems can include gum disease, decay on the teeth that we want to keep, depending on the angulation that they come in, and sometimes they can even cause headaches or your teeth to shift. Some of these problems are very slow in nature, and you won't notice them right away, and it might be too late to do something about it. The majority of patients don't grow their wisdom teeth in straight. It's very, very minor. I've only seen a few cases in my life where they've grown in completely straight. Most of them are at an angle or completely impacted under the bone. At that point, it's best to get them taken out, because the longer you wait, the worse it's going to be, especially regards to age. It's easier to get it done, and it's faster to heal when you're young than it is when you're older. In really severe cases where patients have waited far too long and they're not in their teens or early 20s anymore, it can be quite traumatic and quite painful to heal. There can be things like nerve damage or paralysis in the area, which can be temporary or permanent depending on the case. And patients can end up losing even more teeth than they had originally anticipated. If a patient is interested in wisdom teeth removal, they should definitely find an office that offers panographic radiographs, cone beam CTs if needed, and I definitely would recommend sedation for any type of wisdom teeth removal. So with panographic radiographs and CTs, it allows the doctor to find the exact position of the tooth in relation to the nerves in the jaw, especially on the bottom where it's more important, where it's more critical. And it also shows the doctor the entire structure of the tooth, whether it's just forming or whether the roots are fully developed. It's a diagnostic aid that really helps should be standard of care before anybody gets their wisdom teeth removed. If you ever go to one of these offices and they don't have these basic technologies, you should walk right out the door, because you're going to be in big trouble. If you're interested in getting your wisdom teeth removed, come on in for a complimentary consultation. We'll show you that it's not really that big of a deal. We'll make sure you're comfortable, relaxed, and get the treatment you need. When it comes to customizing a treatment plan for our patients, technology plays a huge role. One of the first things that patients utilize when they come here is our cone beam CT, which allows me to customize a treatment plan for them based on their specific needs. From then, they'll go on and try our Yomi robot, where I'm able to place a dental implant with 100% precision every single time. After that, they'll come get an impression with our intraoral scanner, which is more comfortable for the patient since they don't have to have a goopy mess in their mouth. And then our sprint ray unit will actually print out their crown for them same day, within the hour if need be. At West LA Implants, we pretty much have everything we need to give you a same-day smile. Because everything's under one roof, there's also a cost savings for the patient. I don't have to pay an outside lab to make something. I can just make it here so it becomes more efficient and cost-saving for the patient. And I can also control the quality of everything. If I see something I don't like, I change it right then and there instead of having to deal with a middleman. One thing patients should look for in a practice is the quality of materials that they use. Whether it be zirconia or porcelain or gold, you can rest assured that here at West LA Implants we use only the best quality materials that are going to last you a lifetime. Bringing in technologies like the Yomi robot has allowed me to provide dental implants that are less invasive and less traumatic, therefore the recovery is going to be quicker. If you're looking for a high-tech office that can practically give you a smile in one day, I invite you to come give us a chance so we can guide you to a beautiful smile. The biggest failure that I've ever seen was a patient who had several implants on the top, several implants on the bottom, and their denture was screwed in, but it kept breaking every single time. And unfortunately, I had to tell them that it was due to poor placement and that the whole treatment plan had to be redone. Dental implant failure happens for a variety of reasons. There's a lot of nuances that occur and that one has to be familiar with in order for things to come out correctly. And when one is inexperienced, a lot of things can go wrong pretty easily and pretty quickly. My top 3 reasons for why dental implants fail are: number 1, poor planning. Failure to plan is planning to fail. This is a very technique-sensitive procedure, and if you feel like you're being rushed, or if you go to one of these corporate places that ask for the money up front and the procedure seems like it's being rushed, it's probably not a good sign. Number 2, poor placement. If you don't put it in the right spot, if you don't have the right parameters, if you just throw an implant in hoping it'll heal, it's gonna fail every time. Number 3, poor material choice. Not every implant company is reputable, and not every material is suitable for every patient. When choosing a dental material, there's a wide variety of options you can choose from. One of the best is zirconia. It's very, very strong, it's very lifelike, and it's all porcelain, which is much kinder to the tissues, and therefore is more biologically sound and will have a nice long-lasting restoration. If you have any more questions about dental implants, I invite you to come give us a call We'll invite you for a complimentary consultation and a scan, and we'll come up with a customized treatment plan for you that will deliver you a nice long-lasting result.
Hi, my name is Michael. I got a full mouth reconstruction surgery done by Dr. Barriere. Growing up, there was kind of issues in my house, so dental work was like the least of my parents' concerns. Also, I had a problem with substance abuse and drugs and alcohol. I got sober like 6 years ago, and the first thing that I wanted to do was get my mouth fixed. So I knew that I needed, obviously, to get a lot of work done. I had maybe 10 or 15, or no, maybe more like 5 different consults, and different doctors give me like different treatment plans and opinions, and Dr. Barriere was the first doctor that I met who actually had a game plan and said that, made me feel comfortable with a process that, was affordable enough, but also was like doable.
Michael is an interesting case. He's very young. When I first met him, he was outgoing, but he didn't have that smile to match his personality. He had lost many teeth, his bite was collapsed. His was a full mouth reconstruction with dental implants, top and bottom, and now when he smiles, he has that $1 million smile to match his $1 million personality.
I've been in so many different dentist offices like my whole life, and finally going to somewhere where somebody looked at me and said, like, I know how to fix this. Like everyone else, every other doctor I went to gave me like a laundry list of different methods and different ways. Also, they were gonna, like, every doctor was like a general dentist, and they were like, I'm gonna be the quarterback for this, but we're gonna have to get this dentist to do this type of work, and then to do the implants is gonna be this person. And Dr. B was the first person that said, like, I'm gonna do everything, and we're gonna do it all in this chair. It was a big deal. It was also a lot of work. I also, like, having a substance abuse background, I knew I couldn't do anything with like real painkillers involved or anything like that. So like, I needed to trust whoever I was doing this with, and he made me feel very, very comfortable with just like, that. The surgery itself was pretty rigorous, but I mean, they made sure that I was comfortable in the whole thing. It was actually during March Madness, and I'm a big sports fan, so he had the tournament on for me the whole time. So I literally just sat there and watched like 3 basketball games, and then it was over. Right afterwards, the immediate effect of me just going home and smiling, like I remember just tearing up and saying like, wow, I have teeth again, like, and now getting the final teeth yesterday, it's hard to put into words, but it's the best thing ever.
I had challenges with my mouth for several years now. I had worked very hard on some programs to try to save all of my teeth. I got these wonderful teeth from my father, big, beautiful, wonderful teeth, and I got my gingivitis. I used to smile all the time, and I wasn't doing that anymore. And there's so much self-confidence involved, and feeling good about yourself, and not standing over your hand over your mouth or turning away. And I just really wanted my smile back. One of my brothers had all his teeth pulled a while back and got dentures, and
when Leslie first came in, she was pretty down about her appearance. She didn't smile very much. She was very reserved. When I was taking her photos initially, she was very reluctant to give me a big, bright smile.
My mother passed away this last year, and through a person handling my special needs trust, who is also a patient here, she highly recommended West LA implants to me. And so I came over and got a consultation, liked the way I was treated, liked the staff here, liked the friendliness, so I went forward from there. I had been working on getting the full-on 4 for a couple of years now. So when this place was recommended, I came and checked it out. It was time to move forward.
The route we decided to take with Leslie, because her teeth were so bad, was a full arch all-on-4, top and bottom. She came in for the day of the procedure, and we took out her teeth, and we gave her a brand new smile the same day. The next time I saw her at her post-op appointment, she was very, very happy. She was smiling and laughing. It's cases like this that bring me joy and satisfaction, because I get to see how much it really does transform their lives.
If you're not happy with what your dentist is telling you, come on over here. I highly recommend them. That's how I found them. They came by high recommendations from someone else that's very happy with their service here.
I was having a lot of problems with my teeth because early in life I had more decay with my teeth, so I probably had more cavities as a child and more large fillings as a child. And so as I got older, it got worse and worse, and I was grinding my teeth. I didn't really know I was doing it, and that damaged my teeth a lot. And I felt very self-conscious about my smile. I was very upset with how my teeth looked. They were more discolored, and certainly a lot of crowns were failing at that point, and that was overwhelming in itself. but I am very committed to taking good care of myself, and so this was part of my journey, to take really good care of myself as I get older. And so the dental work was a really important component because I sing with a choir and we do a lot of filming, and I was very self-conscious about my teeth. So I said to myself, I want to get this done.
When I first met Emily, she was very unhappy with her smile and very nervous about dental treatment. She had a lot of teeth, but she was missing a few, and she didn't like the appearance, the color, the shape. They had worn with time and yellowed over the decades. We did all the surgeries in one step. We did all the crown preps the same day, and we delivered her new smile. And now when she smiles, it just brightens up the room.
When they were finishing some of the work and putting on even just some temporary things that looked better, you know, there were no longer certain gaps that were really obvious, I felt like the old me, because when I was much younger, I did have beautiful teeth. And what's really amazing is that Dr. Barriere was able to reproduce that. I mean, it feels so natural to me. But when I look at old pictures of myself, this is so close to what my teeth looked like when I was much younger. So I felt this sense of going back to being younger and going back to how I felt good about my teeth when I was younger. And so it was an amazing moment when they held up a mirror, and even though it was the temporary ones, even they looked good. And then when the permanent ones were put in, I was just blown away. I mean, it feels really natural, feels great. I immediately felt at ease when I came in this office. It's very pretty and it's very soothing, and it has a friendly atmosphere. But I have to say the office staff really impress me. They are so professional, they're very friendly and caring, they're very empathetic. They all go above and beyond to take care of patients, from calling me to see how I'm doing after a procedure, calling me at home, to listening if I have a concern. I never felt like they were dismissive. I was really kind of embarrassed and ashamed that, number one, how much work I needed to have done and how anxious I was. And they never made me feel bad about it. And I would say to someone, don't wait, take care of your teeth. I wish I had taken better care of my teeth when I was younger, but I'm so glad that I found this dentist because he really brought me back to how I felt when my teeth were in good shape. And so now I show it off to everybody. I mean, a lot of people who hadn't seen me in a long time were blown away by how good it looked. And that was for me one of the greatest rewards.